Welcome to Kingston WritersFest. My name is Anne Maureen Owens, Programming Committee member at the festival, and I'm pleased to present this event, The Long-Term Crisis in Long-Term Care. I would like to begin by acknowledging that the land on which the festival customarily takes place and where I sit tonight is the traditional territory of the Anishinaabe and the Haudenosaunee peoples. We gratefully acknowledge these Indigenous nations for their ongoing guardianship of this land. We agree to peaceably share in responsibility for stewardship of this land, its waters, and all its biodiversity. All those who come to live and work here are responsible for honoring these relationships in the spirit of peace, friendship, and respect. I'd like to thank many people, but the Canada Council, Canadian Heritage, Ontario Arts Council, the City of Kingston, and Kingston Arts Council for their ongoing support of the festival. We're especially grateful for this event to the organizations and individuals who support the festival, as particularly Justin Kunitas and Julia MacArthur, author patrons of André Picard, Julie Leclerc and David O'Toole, author patrons for Moira Welsh. This event is an hour long and includes a question and answer period. Feel free to type your questions into the Q&A box at any point during the event for the moderator. You'll find the Q&A button near your video button, and there is also a raise your hand function located in reactions, generally located on the bottom row, depending, of course, on your device. Or you can press *9 to raise your hand if you are joining us on your phone, and we will prompt you to unmute when it is your turn. As a thank you to you for continuing to support Kingston WritersFest and joining us for this virtual edition of the festival, we will randomly select a pre-registered participant of this event following our Q&A. We will do this for each onstage event throughout the festival. If you'd like to support the authors by picking up a copy of their books, our official bookseller is Novel Idea, and they have copies to purchase in their store, by phone, or online. And now I'm delighted to introduce this event's moderator, Ben Charland. Ben is a writer, a podcaster, and a creative consultant. From 2018 to 2020, Ben hosted the weekly podcast, What on Earth is Going On?, which covered wide and varied topics with guests such as poet and biographer Rosemary Sullivan, fantasy author Guy Gavriel-Kay, Canadian actor Aurora Brown, and many more. Ben has been involved with the Kingston WritersFest for the past 4 festivals. This is his 8th event as a moderator. He now lives with his wife and son in Whitehorse in the Yukon. Please welcome Ben Charland.
Thank you so much, Anne. It's a real pleasure to be here. And thank you so much for that introduction. Moira and André, I'm really excited to talk with you. And I'm almost giddy with excitement because there is so much to dig into here with your 2 books. But we're going to start with a couple of readings, actually. So the first one is going to be André. So André is a health reporter and columnist at the Globe and Mail. He's the author of 5 best-selling books, including Critical Care, Canadian Nurses Speak for Change, The Gift of Death, Confronting Canada's Tainted Blood Tragedy, and Matters of Life and Death, Public Health Issues in Canada. There is a long list of André's awards, and for the sake of time and getting a chance to hear from him directly, we're going to fast forward. Now, this is the case for both André and Moira, is that I've got these massive stacked biographies of all the things they've achieved, and we just don't have time because I actually want to get to the conversation. But André's going to read for a couple minutes, then come back to me, and we're going to get to Moira, who's going to read from her book, and then we're going to commence with the conversation. Now, just a reminder before we do that, as Anne said, if you have any questions, please write them in the Q&A. You can also just wait to raise your hand towards the end, but sometimes it's better if the question comes to you, just write it down, and we will hopefully get to it at the end, the last 10 to 15 minutes of this event. André, over to you.
Great, thank you. Thanks for that kind introduction. I'm going to read a little bit right from the start of my book, the chapter 1 called The COVID-19 Horror Show. There's an inquiry going on right now about Héron residents in Montreal, and this is what I wrote about a year and a half ago about this, which is now coming out at the inquiry. On the evening of March 29th, 2020, a small group of local public health officials walked into Résidence Héron, a 134-bed private long-term care facility in the Montreal suburb of Dorval. They didn't know exactly what to expect, but the scene they confronted was stomach-churning. Residents wallowing in their own urine and feces because their incontinence pads had not been changed in days. Others sitting in wheelchairs and lying on soiled bed sheets, dehydrated, hungry, and disoriented, having not been fed or given their medications. 2 patients were on the verge of death. 2 overwhelmed orderlies and 1 other employee were the only staff left on site, instead of the 15 who would normally be working the day shift. The rest had quit or simply disappeared, and management was nowhere to be found either. The first action the officials took was to call in a cadre of nurses to deliver emergency personal care, feeding, bathing, and dressing residents. 1 nurse brought along her family, her teenagers, for a helping hand. Upon reviewing the patient files, the nurses discovered a number of residents had died of COVID-19 at the facility in the previous 2 weeks, but little had been done to protect those who remained, dozens of whom were believed to be infected. The outbreak at Héron was not the first in a Canadian long-term care facility, nor would it be the last. It was also far from the worst, at least in terms of fatalities. But the story, which would only come to light publicly almost 2 weeks later, graphically underscored just how chaotic and dire the situation had become in many elder care facilities, and just how disruptive and deadly coronavirus would prove to be for those living in institutional care. It was less than 3 weeks after the World Health Organization had declared COVID-19 to be a global pandemic, and Canadians were just waking up to how devastating it could be. As the pandemic swept around the world, it shone a spotlight on many existing social woes, not the least of which was how our elders had been neglected and forgotten. The crisis also exposed a tragic reality. The generation that had given Canada its beloved Medicare system had clearly been forsaken by it. On March 26th, Héron reported its first official case of COVID-19, a patient who was transferred to the Jewish General Hospital, where she died. The next day, several more residents were sent to hospital. Many staff members were told to quarantine as a precautionary measure, and the facility struggled to find replacements for them. There's much debate, some of it taking place in legal proceedings, about how much effort the owners of the home made to replace staff. What is not in doubt is that as the virus spread, residents were not getting the basic personal care they needed for several days. On March 29th, the physician visiting Héron called 911 because her patient was quite ill. When paramedics arrived, they found only 3 workers on site and to care for 133 residents. And one of the workers was quite ill. They notified local public health authorities. The director of local public health, Lynn McVeigh, decided to go see for herself, and she brought reinforcements. The scene that greeted them was, quote, akin to a concentration camp, according to a source quoted by the Montreal Gazette, the story that exposed the scandal. Laura Dana Mule, a veteran registered nurse who volunteered to help with what was essentially a rescue mission, was stunned by the sight of dozens of frightened, emaciated seniors. Quote, I'd never seen anything like it in my 32-year nursing career, she said. It was horrific. There wasn't enough food to feed people. The stench could have killed a horse. The 3 other nurses with her worked for 16 hours straight to get the residents fed, bathed, and dressed. Quote, when we finished, I went down to my car and I cried, she said. The next day, she pulled her own mother out of a seniors residence where she lived, convinced she would be much safer at home. It would be revealed later that there had been COVID-19 cases in Héron weeks earlier, around the time of a provincial lockdown of care homes that took effect on March 14th. At that point, coronavirus was spreading rapidly, so care homes were supposed to have separate red zones for infected people and yellow zones for those awaiting test results. But there was little evidence that the sick at Héron were isolated or that the staff took any precautions at all with their care, such as wearing personal protective equipment. It was business as usual, at least until everything fell apart spectacularly. So I think maybe I'll stop there. I look forward to hearing Moira's reading as well and to our chat.
Thank you, Andre. And that was exactly 5 minutes. So good job on that.
Thanks.
Moira, you're up next. Moira Welsh is an investigative journalist with the Toronto Star. She has co-authored investigations that have won 3 National Newspaper Awards and a Michener Award for public service journalism. She was a finalist for the Justicia Award for legal reporting and the Canadian Hillman Prize. She started as a breaking news reporter and soon joined the investigative team, where she has written on social justice, the environment, the lives of people living in seniors' homes. Like Andre, Moira's list of achievements is a little long, maybe too long. So instead, we're just going to get right to it. Moira's book is called Happily Ever Older: Revolutionary Approaches to Long-Term Care. I'm really happy to talk to you, Moira. And if you can just take a few minutes and read from your book. Oh, you're muted.
Okay, thank you, Ben. And my book, as you can tell from the title, took a bit of a contrarian approach. And I told the success stories of homes that years ago transformed the way that the most vulnerable older adults live in long-term care. And actually, many of these homes, or most of them, did quite well during COVID, but they also act as a call to change legislation and policies across Canada. So I'm actually going to read from my epilogue to show why now more than ever, the need for policy change is so compelling. Let's be blunt. If the boomers and those who follow want to change the way they live in their elder years, we'd all better start agitating right away. It takes time to enact real change, and we don't want to follow, or we don't want to get to our older, frailer, quieter stage without those improvements in place. When I presented this notion to friends, most grew somber. I hadn't thought of that, a colleague said during a newsroom discussion. It is a bit unnerving. As they marched through life, boomers reshaped much of society, but now they're getting on. After reaching 80 in 2025, they'll no longer be able to identify as the junior seniors, no matter how much pickleball they play. Another way of pressing the need for government action is to highlight statistics. Dr. Samir Sinha says current analysis shows that if we reach the age of 65, most of us will have another 20 years of life expectancy, of which 17 will be pretty good. I imagine that if I make it to 65 pretty healthy, I probably have another 10 really robust years ahead of me where I'm going to be pretty fit. I can travel all around and do a whole bunch of different things, Dr. Sinha says. The next 5 years after that, I may not have the same vigor and energy that I used to, but I'm still not out for the count. Those last few years may be a bit of a struggle, and this is where I want to make sure I've made preparations appropriately, so I'm not living with regrets. However well prepared, our longer lives present a powerful case for policy change. Here is another analysis that is so chilling, it bears repeating. The National Institute on Aging at Toronto's Ryerson University released a report called The Future Cost of Long-Term Care in Canada. The authors used the Statistics Canada population microsimulation model, considered the gold standard of projection models, to provide a conservative estimate that the cost of long-term care in institutions and community will triple from $22 billion in 2019 to $71 billion in 2050. Dr. Bonnie Jean McDonald is the actuary who worked on the study. Baby boomers are strongly advised to take a long, hard look at their own personal circumstances and plan ahead to the extent that they have the health and means to better protect their future and possibly their more vulnerable selves, says Dr. McDonald. At the public policy level, the availability and sustainability of long-term care in Canada should be an immediate and national priority. Translation: we've almost run out of time. Boomers need to have hard but illuminating conversations with family, she says. So unless you have a whole lot of money, there is nothing good in this message other than the fact that it should, no, it must, push government leaders forward, taking progressive action that will give us real choices in how we live as we grow older. Even more worrisome is the conclusion that shows our current reliance on unpaid caregivers, family or friends, is going to decline by 30% because fewer people will be available to help. If those unpaid hours of care, mostly provided by women, were paid by the public purse, it would add another $27 billion in costs by 2050. As my mother would have said, all of this makes the proverbial ending on an ice floe an attractive option. She'd also point out that warming sea temperatures are melting that ice, so we might be stuck with the choices on hand. In other words, carry on. The good news, and there is a lot of it to go around, is found in the abundance of ideas, programs, and philosophies. Let's acknowledge for a moment that we are starting to focus on the needs of a society with a great many elders. If we push for it, we'll see a greater acceptance of seniors' rights, and according to Australia's Daniela Greenwood, the rights of people to live with dementia, because dementia is out there in the world. Even with no cure for diseases that lead to cognitive decline, scientists are making exciting discoveries, and the rest of us are learning too. Not just the ways to prevent dementia, but the ways that our brains respond to emotion, stimulation, or important, the inestimable joys of music. Nothing we know of yet has such a profoundly positive impact on our brain. Some of the ideas for housing and communities are still in experimental stages, but there is progress. As Dr. Bill Thomas said, things are not possible until they are possible. Thank you.
Thank you so much, Moira. That was great. Thank you both, Moira and André, for those readings. I think in part you've exposed the urgency of this issue and how vital it is that we confront it today, how vital it was that we confront it 10 years ago. In a way, you've done what COVID-19 has done over the past year and a half, which is to show us how broken our long-term care system already was. André, something you say in the very beginning of your book is that COVID-19 didn't break long-term care, it exposed that it was already broken. I want to, though, I'm a nerd for numbers. I've been kind of obsessing over a lot of the numbers that both of you have in your books, whether it's the number of people with dementia, the number of people in long-term care, the number of people in long-term care who have died over the last year and a half from COVID, which is a pretty gross number. But I want to bypass all of that for a second and start on a more personal note. My grandmother is joining us this evening. She is 95 years old. She lives in Edmonton. She's in a form of long-term care. She lives in her own home, something that our family works at every day, frankly, to make sure that that's possible, to make sure that she's happy. But she's in the minority, something that both of you talk about in your books, that home care for seniors is not the norm in Canada. However, one other thing that happens to people as they age, especially in our country, is not just that they become more frail, maybe more quiet, certainly less active in a working capacity, but they seem to have less agency too, including over an issue like this. And this is something that struck me, not just in reading your books, but in doing my research about long-term care, which is that there's this sense that there is a them that we need to care for, that we younger people are responsible, certainly to care for, but they are there, they're over there. They're not necessarily present in this room. I know that my grandmother isn't the only person who is an elderly person who is present today in this conversation. And I wanted to ask both of you, what is the role of a 95-year-old woman in this debate, in this conversation? Because too often I feel we're told that it's our role. And is it important to listen, to ask them questions and to give them some agency in this? André, because you went first, I'll start with you. You're muted, André, sorry.
Oh, well, I just said some brilliant things while I was muted, but I'll start again. I think you're quite right. People do lose agency. We essentially, when people get older, we strip them of their citizenship, right? If you get a little too sick, we ship you off to a home where you live like almost like a prison. You live a regimented life. You're told when to get up, when to sleep, when to eat, etc. When you can go to the bathroom. It's not a nice life. In my book, I call what we do elder apartheid. We really just send people to a different part of society where they don't have rights. And I think what we need to do is do like some European countries do and just say quite explicitly that our policy is that people will live in the community as long as humanly possible, and that we want to see old people every day. And we want to, instead of shipping them off when they're too much trouble, is adjust the way we've designed society so they can live. So if you go to, some Nordic countries like Denmark, they do have long-term care homes, but first of all, they look like homes. They're not 200 beds, they're 24 beds. They put them beside schools and daycare centers because they want young children to see old people, to see that as normal. If you want to cross the street, the light is going to be 30 seconds. It's not going to be 10 seconds because they know that older people take more time. These are all just little things that really matter to giving people agency. So yeah, your 95-year-old grandmother should have a voice. And the most important thing is she should be seen every day by her neighbors, and they should be helping her out, and there should be community supports for her. That's how to get her voice heard. But all of us have to have a say in this.
Great, thanks, André. Moira?
Yes, I think during the pandemic, we really started to see, or perhaps in a sense, empathize with loneliness and the social isolation that older adults feel probably in the best of times, and certainly throughout the pandemic. But I think that brought a bit of a realization to a lot of people, and understanding that I'm feeling lonely and you're feeling lonely. And so it's really interesting because there is a move, I think, afoot, and it's building. And it's also because there's a very powerful demographic of society that started turning 75 during the year of the pandemic. So there's a bit of a confluence of events happening here where their very strong voice is now rising, and it plans to be heard. But I was talking to a group of I don't want to call them senior citizens, but that's how their organization is titled. So I'll say that. And the man who was in charge of it said, "I am tired of being invisible." And I just, he sort of said, once you stop working, you no longer have a value to society. And he's, again, 80 years old, and he feels he's so active in his community, but he feels so strongly about this. And so I think André is right. There are other options out there. Canada spends one of the least amounts of its GDP on home care of the OCAD countries. But certainly if you travel around and look at what's out there, it's very possible to create communities that are intergenerational. I was in Netherlands. There are homes that bring university students in to live with the elders. And it actually, most of them say it changes their lives because they understand suddenly that people are not others once you reach a certain age. They're actually still funny. They can teach you a lot about history. And according to him, they're really good at beer pong. So, and there are other places that have just, restaurants inside the community village. It's meant for seniors, but all people from the different communities come and go. And I would say these ideas are growing now. And I think that's something that we really need to push for and move forward with this kind of new wave of understanding.
Thanks,
I think Moira makes a really important point, that where do we get this idea that old people only want to talk to old people? Why do we segregate them? They want to interact. They want to be part of society. They want to talk to their grandkids and other kids. That's what keeps people alive, is having those connections. And we have to stop, isolating them and stripping them of their citizenship.
So let's keep on this for a second. I have a question about how things got to be this way in Canada. So something, again, that both of you talk about in your book is that in long-term care, the norm is institutional. I think the statistic is that 80% of elderly people in Canada who need long-term care are in larger institutions, and only 20% are in home care. It's the reverse in many European countries. In Denmark, as you mentioned, André, it's 80-20 the other way around. Now, why did we not get the memo? Why did we head off in this direction? And one way to kind of frame this, in the 1960s, if someone were paralyzed in a car accident, for example, they were often told, into an institution you go. That was the norm at that time. That is no longer normal. No one thinks that way. In fact, if we hear a story like that, we find it ridiculous that you would have been told that. The norm today, or at least the expectation, is that there is some family community support and you aren't just shift off to be an invisible human being. We changed over the last 50 years. in that respect. But with long-term care, we seem to be stuck. Why is that?
I think a big part of it is we're very much prisoners of our history. So the history of long-term care is that it came up through the penal system. It didn't come through the health system. It was a place where you sent the indigent when you couldn't afford to live anymore, and you worked for your, you had to scrub the floors and peel the potatoes if you wanted to be fed. And this was a reality in Canada actually into the 1960s. This concept of a long-term care home where actually people take care of you is relatively new. So there's that. And the other stream of this is religious institutions. There's a lot of taking care of charity model, taking pity on people who couldn't afford to live anymore and put them in homes. So that we have that history. And then that was made worse by the advent of Medicare. With Medicare, we funded doctors, we funded hospitals, and we hived off things like long-term care and mental health. They didn't become part of the funding model. So they really went downhill. So I think like a lot of things in healthcare, we are very much prisoners of our history. Other countries adapted, they changed it, they integrated care, they cover a much broader range of things under their public health insurance than Canada does. And we were kind of trapped. We're trapped in this 1950s model that despite the fact that the demographics of society have changed dramatically.
And I think some countries started looking at demographics a long time ago and realized that there was, a big group of people who would be turning older at a certain point. And they began preparing for that, especially the Scandinavian countries. But I think we don't forget here also that our institutions, for example, for people with developmental delays, the last one just closed about a decade ago. And so we really do have this sort of institutional mindset for people. And even though most older people now are not living in long-term care, because you actually have to be fairly compromised to even be admitted to a long-term care home, they're treated as André noted, they're sort of hived off from the rest of the healthcare system. And so they were sort of this other group. So you've got older people who are living in what some people call the house on the hill. So they're just the others who are far away. And then they're treated differently, and the sort of the rules around the homes and the funding that goes into the homes, it's all lesser to a certain extent. And so we've just created a system that doesn't function for anyone. It doesn't function for the people who live there, and it does not function for the people who work there either.
So what are the key reasons why long-term care isn't functioning? I mean, when I look at both of your books, there's obviously issues about staffing, the shortage of workers to go into long-term care. And then there's this kind of systemic lack of funding for long-term care. There's also the private versus public model, the profit taking. But is there a core problem here, or is it just a series of things that are creating a perfect storm? Moira, can we start with you?
That's a great question. And it's both. There is a series of things. There are a series of problems that have existed for a long time. Fundamentally, old buildings, ward rooms that obviously led to the spread of COVID, lack of air conditioning, which is a necessity, especially in the time of warming temperatures, and a lack of funding. But at the same time, there's a core issue in that the homes are operated in a very old institutional style. It's very hierarchical, almost military in a sense that, there are orders and you follow them. And if you're a frontline worker, you're at the bottom of the pecking order. And the residents are even below that. And so we're missing the very human approach that I write about in my book, which really changes the way people live and the way we view aging and long-term care. Essentially, it is no longer just a place, an institution where you get out of bed at 7 a.m. in the morning and you have half an hour to eat your breakfast, and you can't eat dinner before a certain time, and you sit and stare at the floor for most of your days. And actually, most people become quite frustrated and agitated and angry, and that's why there's a lot of violence in homes, because people are bored and don't get outside to step into the fresh air. So a lot of these very progressive homes upturn that philosophy and that approach, and it changes the way they operate, the way workers have their beliefs, and just the way residents are treated all around. So people get to flourish at no matter what age they are.
Moira, I think this is from your book, actually, where you talk about how people in a home are often cared for and safe, but sad and lonely at the same time. And if they're sad and lonely, are they really healthy? And there are, all of the other problems that come up. And you talk about these models of care, like the Eden alternative, the butterfly model, the greenhouses project. Often it seems to me that the universal feature of these alternative models of care, where people are happier, are happily ever older, frankly, that they place the individual resident at the top of their organizational pyramid. If we did that, would we solve all the problems, or is there still more to figure out here?
I think we would solve a significant number of problems, but I mean, there are other pieces to put in place as well. Some of the structural issues are there. For example, the design of homes. We now know that smaller households create a more familiar, friendlier atmosphere for people, especially those with cognitive decline, who are their world is shifting to begin with, and it's always changing. And so familiar is important to them. A normal existence is important, not these big 32 bed units with a big nursing station and uniforms and so on. So there's a lot of structural change that we need to make. But overall, that is a supporting piece to the transformation of the philosophy within homes. And whether it is one of the philosophies or models that you just said, or something different, because not everyone has to follow the same road to get there, that changes everything for the individuals and people. I wrote about a woman who was 91 years old in Saskatoon, who actually bought her first bathing suit at that age of 91 and took swimming lessons. And so it's just sort of symbolic of the fact that we can always live up to our potential at whatever age we are and whatever ability we have, if we're given the opportunity to do so. And that's what these ideas will do for older people.
André, where are you at on this one?
Yeah, I think, Moira said it well. I think essentially the fundamental problem is we have this industrial model that people are just widgets to be cared for. And I use the term care loosely, to be given, to be done things to at specific times. It's really task oriented. And then what she writes about in her book very well is writing about these homes that become actually about the person, where you have agency, where you can eat when you want, when you can get up when you want. You actually are treated like a person. So that's the fundamental one. And then, of course, there are, as you mentioned, the technical issues. We don't have enough staff. They're not well trained. We don't have, for example, personal support workers are not legislated in any way, so anybody can hang up a shingle. So you get, the care is not always great. The infrastructure is way out of date. Most people in these homes have dementia, and the homes are not made for people with dementia. They don't have wide corridors for wheelchairs. They don't have walking tracks, which you need. Every home with dementia should have like a figure 8 walking track, because people with dementia get upset if they come into a wall. So they should be able to walk around. They should have access to the outdoors. They should be able to get up in the night, because most people with dementia are up in the middle of the night, and they shouldn't be punished for that or sent to hospital, which often happens because they're quote unquote disruptive. So we have to actually build homes purposefully for the clientele. We can't expect the clientele to adapt to our old buildings, which is what we've tried to do.
When it comes to these bigger structural issues, I wanted to talk about this word, a covenant, or a promise that has been made at some point in the past. So André, this is something that you mentioned in your book, that there was a blue ribbon panel appointed by the Royal Society of Canada, and the report came out from that panel in June of 2020. This was after, obviously, COVID had begun, and it was clear to the whole country that this was a disaster. Again, not just because of COVID, but what COVID had revealed underneath. And the report said, and this is quoting from your book, André, "We failed them. We broke the covenant." So we talk about how long-term care is not properly funded in this country. It's not part of our Medicare system. And yet there still is this promise. Is the promise rooted somewhere in our country, in our culture, or is this something we have to create anew?
I think the covenant is established in our values. I think Canadians have good values. We individually, we love our mothers, we love our grandmothers. And I use the feminine because that's who's in these homes for the most part. So we have good values. And to me, we just have to make them collective values rather than individual ones. And I think that's what the covenant is. The covenant is when people get old, we should take care of them because they've been taking care of us our whole lives. They've been paying their taxes. They've been raising their children. They've been building society. You know, to me, one of the great perversities of COVID-19 is that we saw the generation that gave us Medicare was essentially forsaken by it, right? It was like a slap in the face. These are people who heart and soul built this quite a good healthcare system, and they were shunned from it because we just didn't build it broadly enough and widely enough and smartly enough. So yeah, I think there is a covenant there. It's maybe unspoken. Maybe we should articulate it in legislation, but that doesn't matter. What matters is changing our attitudes. And I mentioned this earlier, but I always come back to that. The fundamental change we need in society is to just explicitly state a philosophy that we believe that people as they age should stay in society. Our policies all are ageist. They're exact opposite of that. Once you have that philosophy, everything else is actually pretty simple. It's just plumbing, right? Once you have a good blueprint, it's easy to do the plumbing. And we just have to articulate that blueprint more clearly.
Moira?
Yeah, I think we're at a point now where we know what needs to be done. Really, there's no more need for discussion or any more commissions or so on. We're quite well aware of what needs to change. And so the point now, I think, is to hold governments and in a sense ourselves to account for the way that we want to move forward. So for me, it's actually pretty simple. It's just making it happen now.
Great. I just wanted to remind everybody in about 5 minutes or so, we're going to turn to the Q&A. So if you have any questions, make sure to click that button at the bottom and write your question into the Q&A or in the chat, really doesn't matter. I'll see both of them and I'll bring your questions for André and Moira. But I wanted to talk about this last bit about making this issue get some attention, putting this issue in the spotlight and actually getting these things done. If we all kind of agree what the problems are, and we all agree essentially how to solve them, because that's what was interesting. Even though your books are different, they're complementary. And they also both seem to say the same thing in terms of the prescription for how to solve this problem. But they also say that we need to put a light on this and we need to make change urgent and now. But one thing that I found interesting is that, and this is Moira, in your book, you talk about, there's actually a quote which I found really interesting. It's from Bill Thomas. The positive story is the most dangerous story you can tell, which I found really interesting from a journalist who works in a business where if it bleeds, it leads. And André, in your book, you often highlight the positive as well. And trying to see not just the silver lining, but the good stories that can come out here, the positive parts of life, that long-term care shouldn't actually be the shackles around our ankles, but rather an opening up at the end of life, a good time that is enabled by us as a larger country. So, but that's still a tricky one. Is the positive story the way to do this?
I think you have to have a little bit of both. I think we have to expose the horrors. You talked about being a data geek, so am I. We have 27,500 COVID deaths in Canada to date, and 18,000 of those are in long-term care. This is the vast majority of death. This is carnage on a massive scale like we've never seen. I don't think we can overstate how serious what happened is. So first of all, if that doesn't drive change, I don't know what will. If 18,000 dead grandmothers doesn't make us smarten up, I kind of lose hope. On the other side of the coin, I think it's really important to tell people, because this is a depressing area. It's easy to say, oh, there's too much to do, it's hopeless. And it's not hopeless. We know, as Moira said very well, we know every problem, we know every solution, and we've actually implemented a lot of solutions. There's a lot of terrific care homes. She writes about some models. I write in my book about Sunnybrook Veterans Center, sort of the Cadillac of long-term care. It doesn't cost any more than anything else. It's not any more difficult to manage. They just put their mind to it to do it right. And I think people should know that this can be done really easily without much effort. It just takes a desire to do it, and we can change quite radically and quickly if we want to.
And I would say that we're quite aware of the issues, and I mean, many of us will continue to write about these issues, But I think by telling the positive stories, you're actually able to expose the fact that change can happen. And it's been actually working in homes for decades now. So this is not a novel approach. And that was what Dr. Thomas, his point was, is that the more negative stories you tell consistently, the bar is lowered basically because people give up hope. It's too much. And I agree with André, though, at the same time, the very sad stories must be told. And throughout the pandemic, we wrote those. And I'll tell you, there's another piece of long-term care that really needs attention. And part of the solution is the fact that people are leaving the industry, workers are leaving. They've been traumatized throughout the pandemic. And if they were already running ragged before COVID hit, they were devastated by it. And I've interviewed nurses and personal support workers, and their tenor of their voice when they talk about their experiences, some of them, wrapping bodies of residents they loved into body bags and then wiping those bags down with bleach because the funeral home couldn't come in. And so they were suddenly, this job was thrust upon them as well, in addition to everything else. Those workers, many of them are gone for good. And so if we want to attract people to work in this industry, we need to offer jobs that give them purpose, give them autonomy around decisions and emotional well-being of the people they're caring for, and make them an important part of the care team. And that's something that these positive stories or positive approaches can offer. And that's how you can sort of shift the negative a little bit closer towards moving towards the positive.
And that staff component is really important. Pat Armstrong, a sociologist at York University, has famously said, the conditions of work are the conditions of care. And I think COVID taught us that really graphically. If you treat workers badly, they're never going to provide good care through no fault of their own. They just won't have the ability to do it. So it's important to treat residents better, but it begins with treating staff better, paying them decently, giving them benefits. Don't force them to work at 3 different homes a week to carry disease around. Make their jobs pleasant. Don't allow them to actually talk to people, not to just do tasks and treat people like widgets. That's what they want to do. And we have to make that easier, and everyone benefits from that, from treating staff better.
Yeah, it was interesting in doing research for this. Again, just talking about the positive and the negative and how to frame this. When I obviously you both talk about Elizabeth Wetlaufer, who is essentially a nurse who was a serial killer who only was discovered when she confessed in 2016 to murdering, I think it was 8 people and attempting to murder 6 others, all of whom lived in long-term care under her care. But it seemed to me that every time a negative story comes out, and André, in your book, you say that usually, if not always, when elder care comes out in the news, it's usually news of the worst kind, quote unquote. But when a negative story comes out, it's very narrow. It has a very narrow focus that this nurse was doing this. So how do we solve that single problem? People are dying because of this, or dementia care facilities are not up to snuff. How do we solve this one issue? But a positive story, again, such as the butterfly model, which is such an interesting way to deal with long-term care, is an all-encompassing positive story where you hear about someone living their last 20, 25 years from beginning to end. And it may not be as headline or attention grabbing, but it's all encompassing, and it gives us a way forward, so to speak. And I found that in both of your books that there was both this, not a narrow focus, but picking out the negatives, but also providing a positive, large frame approach that we can almost take either of your books and say, this is the prescription for the future. We're going to move over into the Q&A now. So if anyone has any questions, please write them there now. I've got a few in front of me. And if you don't write questions, that means I get to ask more. So it's totally fine by me because I've got many, many more questions. So I've got a comment here, which I'm going to turn into a question. With respect to core failings of the healthcare systems regarding elder care, one of them has been the fundamental indifference of all levels of government, to development of effective home care programs. And I'm going to turn that into the question, is there an example of government that is doing it right in Canada, not just foreign, but is there an example in Canada where a government is at least trying within their means to do this right?
I think, it varies. The care varies. The ability to access home care varies. I think Manitoba is an example of a province that has invested a lot in home care. It's kind of known. So every province does some things better than others. And so I'd say Manitoba definitely has set a good example on home care, but it's still pretty modest. We have this bias about home care. There's just this assumption, this really deeply rooted assumption that it's too expensive. And it's not true. It's not more expensive than long-term care most of the time, because long-term care has overhead, and the overhead is very, very expensive to maintain. So I think we have to, if we can shake off this notion it's too expensive, we could make a big change fairly quickly. But the other problem with home care is it's also just an industrial model as well. It's like we go in and do things to you, whether you want them or not. You're going to get your bath on Wednesday at 2 p.m. And I don't care if you don't want a bath. That's when we're assigned to do it. That's not how to treat people. You have to give people some time with a caregiver, and they decide how it's used.
Moira?
I think one of the interesting things that I saw was that some governments stepped out of the way of innovation. And while they weren't regulating that all homes must innovate, when you did have a bold leader who decided she wasn't going to sit back and just listen to what the bureaucrats told her, and she was going to push ahead. And I'll use Sue Ellen Beatty from Saskatoon Sherbrooke Community Centre as an example of that, when she built the tiny households that actually inspired the greenhouse model. She just said she was going to go ahead and do it, and she did. And so I think in some cases, governments, they don't mandate change, but they're allowing change to happen if the people are willing to sort of fight the system.
Yeah, I think, Moira makes a really important point that we always complain, and I'm the first among us to say governments need better policies, but sometimes the best thing government can do is just get out of the way. And there's not enough of that. Just get out of the way. A lot of community groups have solved these problems, but just stop putting barriers in their way.
There's a related question here about privatization and versus public long-term care. And André, there's actually a quote from your book from Dr. Tamara Daly, who says, "The research is clear on this. There is no doubt that reducing profit taking would improve care." Now, I don't need to get us political here, but I just want to expose this question that someone has written. How do we address the fact that the care provided in private long-term care homes was poorer in comparison to public ones? Can we unprivatize long-term care? And I guess a caveat to that is that's not universal. I think, Moira, you talk about this in your book, that it's not universal that public is good and private is bad. There are good examples and bad examples everywhere. But should we and can we deprivatize long-term care?
Well, I'll start by saying we can do anything we want. I think my view on getting rid of private care is we don't need it, but I worry about simplistic solutions to complex problems. So I think the reason that private homes have worse outcomes is not because they're private, it's because they have way more 3 and 4 bedrooms that are more profitable. So you have to figure out what is the source of this. So to me, it's about number 10 or 20 on the list of things that needs to be fixed, this privatization. If Quebec has very few private homes, Quebec had the worst outcomes in long-term care. It's not a one-to-one problem. It's complicated, like many things. There was a report in Ontario that came out during COVID looking at what happened in their care homes in the first wave, and they made a really excellent recommendation. They said that all care should be provided by not-for-profit or government, and I think that's essential. That's where the care provision should be. Who owns the buildings doesn't really matter. Who you pay your rent to, I don't care if that's a private company or a community group, whatever. And we have a situation, especially in Ontario, where we have real estate companies. These are very profitable homes because of the real estate, not because of the care. The care loses them money. They don't want to be providing care. We don't want them to be providing care, but they have to if they want to own the building. So what this report said is separate those two functions. Whoever owns the building, pay them rent, and that's fine, and let institutions, our public institutions, run long-term care homes. That's the solution to me. Rather than this nationalizing homes overnight, I think that would be incredibly expensive. I think actually private industry would be very happy because they don't want to really be in this business. They'd be happy to just get rent paid to them.
It really is in some ways, it is a real estate game for some of these private companies. And I know that I've written about this. They've attracted international investors to Ontario's long-term care scene because of the expansion. But the reality is that it's going to be with such a big bubble of older people who need care, some of whom, not all, but some of whom who need care. I think Andre's right that it's a bit of a distraction to move off in a different direction. I think that if we have standards in place and better expectations of all, perhaps that sounds altruistic, but I think that there's much to be gained by doing that. And definitely not-for-profit management operators, so to speak, would potentially make a difference. But at the same time, I've written about, for example, the Peel Region nursing home that had the butterfly program. It was, by anyone's standards, a really good home. And when I went in there, it was devoid of any kind of human interaction. And that's what we would consider a good municipal home. So it wasn't a for-profit home. And yet people were sitting, again, staring at the floor for their days, bickering with each other, just sitting staring out the windows. It was an absolute life of boredom until they changed it with this other program. So it just goes to show there's one isn't a full-on panacea for change.
Right. The next question from Pauline Lally is actually my fault because I kept bringing this up and now we need to explain it. And she asks, what is the butterfly model?
The butterfly model originated in the United Kingdom. It shares a DNA with most of these other philosophies and models that I've written about, because basically it comes down to kindness to other human beings. But butterfly is intended for people with cognitive decline, and it focuses on their feelings in the moment. So a lot of people will relive their past, often a very traumatic moment. And so they talk about how to meet someone in that place, and also how to give someone purpose in life by trying to find out who they were during perhaps their career, what they loved doing, maybe as a hobby. And so from talking to the people at Butterfly at Peel Region, they really work hard to try to sort of figure out how to meet someone, their individual needs. And I'll give you one example. During the pandemic, there was a lockdown, and there was a woman there who was quite a fashionista during her time. And she just loved men, loved talking to men, but she was very lonely during this lockdown. And so they brought in male workers, I think from Peel headquarters actually, to come and just sit and have tea with her. And they also brought in a mannequin, and they would bring in different outfits every week, and she would help choose the outfits to place on the mannequin. And that gave her joy in her life and purpose in a sense. And so that's in a nutshell, that's what Butterfly helps homes do. And most of them do something generally similar.
Right. André, is there a model of care, one specific thing that you think rises above all others, or one that just had a really big impact on you when you first learned about it or experienced it, discovered it, whatever?
I think, Moira in her book writes about these in great detail. I think that what's important is they share the more or less the same philosophy, that it's people that matter first rather than the tasks. So I think that's ultimately what matters, regardless of the name, and they have all slight details that are different. I was really struck by Sunnybrook. It doesn't have a fancy name. It's just a veteran center, but it's just, I think it's important to highlight because it's in the public system. It just has this person-centered model. And I'm saying in the book, we owe our veterans a lot. We should treat them exceptionally well. But why don't we treat every elder well? It just, if you didn't serve in the war, doesn't mean you should get second-rate care. So they just do really simple stuff like Moira talked about. How do you, when you go into a long-term care home, the reality is you're going there to die, right? You don't have a lot of life left. The average stay is less than 18 months. So let's make those days as joyful as possible. And that's what they do at Sunnybrook. They have a pub, they have a library, they have a lovely garden where you can wander. People get up when they want, they eat when they want. If they want to play cards and cuss, they can do that. They do what they want. It's actually their home. One of my favorite anecdote in my book is from Sunnybrook. A nurse is out taking a patient or resident, for a walk. The average age of the residents there is 96. So this person was over 100, and they were out in the garden, and he bent over and he was pulling out all the flowers. for whatever reason. People, you don't know exactly what people with dementia are thinking all the time. And the gardener came over, and the gardener was very upset. You have to stop him pulling up the flowers. I worked on that flower bed all morning. And the nurse said, no, this is his home. He can do whatever he wants. And that's what matters, is that philosophy, regardless of the name you give it.
Right. That makes a lot of sense. And just to echo you, André, on Sunnybrook, I actually used to work for Veterans Affairs and went on a tour of Sunnybrook Hospital once and went into a room where the residents were making art. They were painting. There were about 10 of them in a room, sitting around a wide table, having a really enjoyable time, but also really focused on the work that they were doing. It wasn't just a social gathering. This was serious business. And I remember looking over one woman's shoulder, and she was painting, I think it was like a raccoon, and I couldn't believe it. And I asked one of the attendants in the room, I said, so she was an artist, I guess, in her life, because there's no way. And she said, no, she's just learned that over the past 5 years. And I was so struck by a new life that can be offered at a place that we sometimes consider to be the last chapter rather than the first chapter of something new. And it was really not just heartwarming, but hopeful, hopeful for myself, let alone those who I know who are elderly, heading in that direction. We're going to close out in just a minute. We don't have any further questions in the Q&A, but I just wanted to ask both of you, just to close us out, to bring it back to the personal once again. There are a lot of people who are here today in this conversation, listening and watching, who may either be elderly themselves, heading towards long-term care perhaps one day, or have someone in their care who may be going to long-term care. We talk a lot about the bigger structural issues, maybe what we should be voting for or what we should be supporting in the public sphere, but what should we be doing as individuals? What should we be doing, whether we're the elderly person or the person supporting that elderly person, when we're looking at long-term care, if we even have agency? I recognize that I think the waiting list in Ontario for long-term care is 36,000 people long or something, but is there something that we or they can do when dealing with this?
I think two really important things. I think one is to, recognize that we have a self-interest in this, all of us. Every one of us is going to become a caregiver and a care recipient. That's almost 100% guaranteed, given the stats. I've had two parents who required care for many years. We're all going there. I've warned my kids that they're going to have to take care of me, and I'm going to be a curmudgeonly old bastard, and they better get prepared. And that's the second part of it, is be prepared. I think the single most important thing you can do is to have conversations around the dinner table. How do you want to be cared for? Where do you want to live? When do you want me to say no to your treatment? These are decisions you should make when you're of sound mind and sound body. Far too many people have to make life and death decisions in a time of crisis, and that's the worst time to make them. Be prepared. It takes, I can tell you from experience, it takes a terrific burden off your children, off your caregivers, if you give them direction, if you tell them what you want, so the siblings don't have to fight about it, so they don't have to guess. They want, we all want to do right by our parents and our grandparents. So have that conversation while you're healthy, and give people, give them some direction about how you want to live and where, and then it's up to us to carry through your wishes. Great.
Moira, last word.
I would say live well right now. Learn an instrument, or read books and walk and exercise, and stay as powerful as you can for as long as you can, because I don't think any of us really want to end up in long-term care. And if that day comes, then yes, absolutely, the planning is super important to make it. André talks about asking the parents what they want. So it's person-centered planning. What do you want, Dad? If this situation arises, and remember what he says, because that will be meaningful to him at a certain time. But if you're looking for housing, there are other options that are growing out there as well, like different ways of living that I think are really important. But if you're going into long-term care, ask questions about the home. Ask how they interact with the residents. Go try to visit on off hours, if at all you can get into the home, and just see what it feels like. And that makes a big difference.
Great, thank you. This has been a really wonderful conversation, Moira and André. I really appreciate you taking the time. I'm going to pass it back over to Anne to close us out.
Thanks very much. And thank you, Ben and Moira and André, for a very, very good discussion on this very important topic. Quick reminder that Andre and Moira's books are available now at Novel Idea. The participant of this event, who's our winner for books this time, I'm going to show them, is Judy Henderson. So Judy, books should be coming to you soon. Thank you for joining us and supporting Kingston Writers Fest. Be sure to check our website, kingstonwritersfest.ca, for the rest of our great lineup. Thank you so much for coming.